This is Dr. Jeffrey Jelic answering the question, how long does it take to recover from wisdom tooth extraction? Multiple studies have demonstrated postoperative pain and the length of recovery are related to the experience of your surgeon and the length of the procedure itself. Additional studies evaluated patients' variables such as sex, age, and tooth position and determined that younger people, men, and people with more vertically oriented teeth had less complications and more rapid return to normal activity. An experienced oral and maxillofacial surgeon will be able to identify the criteria that will shorten or lengthen your individual recovery and advise you accordingly. Recovery from wisdom tooth extraction can be generalized into 3 phases: hours, days, and more than a week. Recovery from sedation, enough to leave the office, is typically about a half an hour, while recovery from sedation to drive a car is approximately 24 hours. Postoperative pain peaks around 8 hours after surgery, and swelling will peak around 48 hours. 4 to 5 days after surgery, you will have recovered from swelling, jaw stiffness, and returned to a normal diet. Your extraction sockets may take 2 to 3 weeks to fill in and look normal. Recovery for full contact sports may take 4 to 6 weeks. Your return to work or school will depend a lot on your narcotic usage and your employment responsibilities. If you're only taking non-steroidal medications such as Motrin and Tylenol, return in 24 hours may be possible, but we recommend 48 hours. Patients whose employment requires vigorous physical tasks should wait at least 72 hours. Travel plans, depending on the destination, should be delayed 1 week in the event that a dry socket or infection needs to be managed.